Pratyush, MD Medicine. Today our discussion will be on what is high blood pressure and how to prevent. Everyone should have healthy and normal blood pressure, but what exactly does it mean? First, we should know what is blood pressure. Basically, each time when the heart beats, it pumps blood into the vessels and it creates pressure against the wall of the blood pressure. This is called blood pressure. It can be measured by two numbers, by systolic and diastolic. Systolic means when the heart pumps and blood enters into the blood vessel, that produces pressure against the blood vessel. This is called the systolic blood pressure. And diastolic blood pressure means when the blood creates pressure on the blood vessel during the resting state of heart. Normally, systolic blood pressure around 120 and diastolic blood pressure around 80. Normally, in healthy person, it rises and falls throughout the day. But when the blood pressure remains high for longer time and left untreated, it can lead to very serious complications like cardiovascular disease, stroke, kidney disease, retinal damage, etc. So the control of blood pressure is very important in day-to-day practice. Now coming to hypertension. What is hypertension? Hypertension on recent classification is that defined when the systolic blood pressure more than 130 and the diastolic blood pressure when more than 8. High blood pressure usually develop over a time. It can happen because of unhealthy lifestyle. For example, like reduce or a small amount of physical activity, obesity, smoking, high alcohol consumption, etc. Normally, the physician it divided in two groups. One called primary hypertension. That means when the exact cause is unknown. The main factor in primary hypertension are the ages, family history, unhealthy lifestyle, already I have mentioned, etc. And secondary hypertension, that means when the hypertension due to some serious disease like chronic kidney disease, cardiac disease, like coarctation of aorta or valvular heart disease, like etc. And also some hormonal disease like adrenal gland tumor or hypothyroidism or hyperthyroidism, etc. So hypertension can be divided into two groups, primary and secondary. Most of the physicians usually deal with primary hypertension because the hypertension commonly seen among the population, mostly primary hypertension. Now, coming to primary hypertension. Primary hypertension usually develop over time and mostly due to age-related disorder and also some lifestyle-related disorder like less physical activity, obesity, smoking, high alcohol consumption, stress, etc. Age. Now coming to age. Age, as the people get older, the artery becomes stiff. And when the heart pump, it creates a high blood pressure. Family history. Family history, if one or more family history of family history of blood pressure, like mother or father have hypertension, then there is chance of hypertension among them children. Excess amount of salt intake is very important factor. Normal recommendation is 6 grams per day. If there is high amount consumption of salt, that creates high blood pressure. Eating less amount of potassium containing food. Eating processed and fatty food, that creates body mass, like that ultimately leads to obesity. Obesity increases hypertension. Another most important thing that stress. Reacting to stress is unhealthy way, and not managing stress can also increases blood pressure. And another very important risk factor are smoking and alcohol. If both are very common in people that have a chance of more hypertension. Moving on, the hypertension does not have any obvious sign. Now coming to hypertension, sign and symptom. Hypertension usually does not have any obvious sign and symptom. That's why often it is called silent killer. It puts people at risk of several diseases, from cardiovascular problem to kidney failure, stroke, even eye damage and blindness. Hence, early accurate diagnosis is very important in management of hypertension. Measuring the blood pressure is the only way to whether a person have high blood pressure or not. Generally, symptoms does not occur, but when occur, it usually presented with clinical features, some features like high headache, tiredness, vision change, nausea, vomiting, etc. So if a person experiences some of these symptoms, then one should get their blood pressure checked. Blood pressure usually measured by sphygmomanometer, and I have already mentioned that it has two numbers. One measured by two numbers, systolic and diastolic. And usually it should be systolic pressure should be less than 120 and diastolic less than 80. If blood pressure level more than 140/90, then the person have hypertension. If a person have hypertension, then he or she might at the risk of developing serious problem like kidney disease, heart disease, retinal damage, stroke, etc. So the prevention and the management of hypertension is very important. I have already mentioned that hypertension is two types. One is primary, that there is no obvious cause, mainly due to age-related, and others are lifestyle-related disorder. So this is very important. And another are secondary hypertension, mainly some cardiac, kidney, or hormonal disease that can be treated another way. Now, coming to primary management of prevention of primary hypertension, the risk can be prevented and reduced by taking steps toward healthier lifestyle, such as regular exercise, healthy diet, quit smoking, regular blood pressure monitoring, stress management, and adherence to medicine. If the blood pressure is successfully controlled with such lifestyle modification, when it might avoid, delay, or reduce need for medication. So let's take a look at this strategy one by one. Regular exercise. Exercise can drug-free approach to lowering the blood pressure. Regular physical activity makes people heart stronger. If one has strong and healthy heart, it can pump more blood with less effort. So if the heart has to work less to pump, it forces the blood vessel to decrease and lowering the blood pressure. In other hand, as well as our that the age and weight is gained are the two major risk factors for high blood pressure. So if blood pressure is to desirable level less than 120/80, then exercise can help to prevent rising hypertension with age. Regular exercise is very important. I have already mentioned, and usually my opinion in an one should at least 30 minutes of aerobic exercise most of the day of the week. High blood pressure level can be reduced by doing regular structure exercise such as this, walking, jogging, swimming, etc. And one should maintain his BMI less than 25 kgs per meter square. Now coming to healthy diet. Diet also play important role to controlling blood pressure. A diet with a high intake of vegetables, fruits, and whole grains is recommended for hypertension patients. For lowering the blood pressure and preventing hypertension through dietary intervention can be adapted dietary patterns such as DASH diet or Mediterranean diet, eating less saturated fat and total fat, getting plenty of potassium, and limiting the amount of sodium in diet, limiting alcohol consumption. Now coming to the DASH diet. Eating DASH diet, that is rich in whole grain fruits and vegetables, and low fat diet produce as keen to saturated fat and cholesterol can lower the blood pressure by up to 11 millimeter mercury having blood pressure. reduce sodium intake. I have already mentioned that daily intake recommended less than 6 gram sodium chloride. So the less reduction in sodium in diet can improve the heart health and reduce the blood pressure by about 5 to 6 millimeter of mercury if they have high blood pressure. To decrease the sodium in our diet, we can consider things like, read the food level. If possible, choose low sodium alternatives of the foods and beverage you normally buy. Eat a fewer potassium. You eat a fewer processed food. Only a small amount of sodium occur naturally food, but most of the sodium is added during the process. So we can eat natural food and don't add salt during taking food. Quit smoking. It is very important. Stop smoking help our blood pressure return to normal. Quitting smoke can effectively reduce our risk to heart and improve our overall health. Alcohol consumption, reduction of alcohol consumption also very important. It is recommended 2 drinks per day for men and 1 drink per day for female, where each drink containing 14 grams of ethanol. And if the hypertensive patient reduce alcohol intake, that ultimately leads to decreased blood pressure. Next, the most important point, that is the regular blood pressure monitoring. If we see that some of the hypertensive patients check blood pressure by visiting doctor, but it is not always possible for patient to visit the doctor and check their blood pressure. Hence, the most often I advise patients self-monitoring the blood pressure. Self-monitoring helps a person to measure BP at different times throughout the day over a long period, and it also assists the doctor to get a more complete picture of person blood pressure regarding at different times. Further help us in better prediction of cardiovascular morbidity and mortality than single routine blood pressure measures that occur during the health stress management. This is very important point. By learning how to relax and manage the stress can improve the emotional and physical health and lowering the blood pressure. Stress management technique, including exercise, listening music, focusing on calm or peaceful uh, thing, and also meditation. Now coming to the medicine. A medicine to lower the blood pressure may be recommended by the doctor. If the blood pressure is consistently high, usually above the 140/90, adherence to medicine is very important as a control the blood pressure regularly. At least I would like to suggest that there is nothing more precise than having a fit and healthy life. Adapting the healthy lifestyle can help us to enjoy the long and healthy life. High blood pressure can be prevented by as well as controlled in many ways. Keeping full pressure in a normal range is very important in preventing cardiovascular complications. It is very much possible to maintain the normal blood pressure level with regular monitoring and preventive care. Thank you.